Alright everyone, so the purpose of my speech today is to inform everybody about Florence Nightingale and the important role that she played in modern nursing. So I want everyone here to take a moment and think about a time that you had to go to the hospital to get stitches or maybe even have an operation. Most likely this did not result in a life-threatening infection or death. And Florence Nightingale is who we should thank for that. So nursing is something that I have a strong passion for, and without her it's possible that this field of study would not even exist. She had such an impact that she has been referred to as the mother of modern nursing. Florence Nightingale became a prominent figure in the early 1850s during the Crimean War. She noticed a lack of medical attention for the soldiers and the unsanitary conditions in which they were kept. She made the connection between the two, and she started working to get the hospitals cleaned up, and she started round-the-clock care for all of her patients. She was also well known for the nickname, the Lady with the Lamp. And the reason for this is because she carried a lamp around at night, checking on all of her patients one after the other. She is who set the standard for sanitary conditions when caring for her patients by washing her hands, cleaning the linens, and making sure everything stayed clean. She actually reduced the mortality rates during the war by 2/3 because of the standards that she kept. She was also highly regarded for her work in professional nursing. She was a manager and she trained the nurses in the Crimean War. And she also started the first nursing school in London in 1860, which paved the way for women and future generations of nurses. She was also the first one to bring about the first public health bill, which would require owners of existing properties in Britain to connect to main drainage systems, which meant less standing water and less sewage in the streets. This alone increased the average life expectancy by 20 years between 1871 and the mid-1930s. So real quick, I want everybody to take one more minute, and I want you to think about what you would expect to see if you went to the hospital or a doctor's office for the first time. Okay? You would probably want a clean bed. You would want the doctor and the nurses to use clean instruments. And you would also want them to have a clean appearance, clean hair, and clean clothes when they come to see you for the first time. And you would hope that they would only touch you with clean hands and clean gloves. You would probably also hope that they would wash their hands after they left you to see the next patient. So these are all standards that were set forth by Florence Nightingale. Now today, some traditions that we carry on to honor Florence Nightingale is we have nursing students that have completed their training recite the Nightingale Pledge, and this is a pledge that lets everyone know that they're going to maintain their standards in care and take care of patients the ethical way. We also have a Florence Nightingale Medal, which is given to nurses and nurse aides every 2 years, and that is in recognition for outstanding service. So for all of us in the medical field, we should always hold ourselves to the highest standards and continue to provide the best care to our patients just as she did. Thank you very much.